Your cardiologist prescribes you a statin to lower your cholesterol. Your dermatologist gives you antibiotics for acne. The psychiatrist puts you on an antidepressant. That's 3 different doctors, 3 different medications, all working to help you. But here's what none of them ask you. What did you eat for breakfast this morning? That grapefruit juice with your statin just increased your medication levels by 300%, putting you at risk for serious side effects. That glass of milk with your antibiotic, it blocked 80% of the medication from being absorbed. That St. John's wort supplement you're taking for stress is cutting your antidepressant effectiveness in half. I'm Dr. Remi Olukoya, a clinical pharmacist, and I've spent over 2 decades watching brilliant treatments fail. Not because the medicine didn't work, but because nobody talked about the food. Welcome to When Food Meets Medicine, the podcast where you uncover the hidden interactions between what you eat and what you take. This is episode 1, and today I'm going to show you why this conversation matters more than you think. There's a conversation nobody's having. Let me tell you about a patient I would never forget. She was in her 60s, taking warfarin. Warfarin is a blood thinner, and you take it after a stroke. Her doctor monitored her blood levels every month. For 2 years, everything was stable. Then suddenly, her levels started swinging wildly. 1 week, her blood was too thin and she was at risk of bleeding. The next week, it was too thick and she was at risk of another stroke. Her doctor was baffled. They checked her medication and adherence. Perfect. They checked for drug interactions. There was none. They even increased her monitoring to twice a week. Nothing made sense. Until I asked her one simple question. Have you changed anything about your diet? It turns out she started drinking kale smoothies every morning. Her daughter had convinced her it was healthy. And it was, except for one problem. Kale is loaded with vitamin K. It directly counteracts with warfarin. So every morning, she was essentially undoing her medication with a healthy smoothie. Here's the thing. This isn't rare. According to research, food-drug interactions affect up to 20% of patients taking prescription medications. And that's 1 in 5 people. Most of them have no idea it's happening. We live in an era of incredible medical advances. We can transplant hearts, we can cure cancer, and manage chronic diseases that used to be death sentences. But we're missing one critical piece of the puzzle, the intersection between food and medicine. Your cardiologist knows heart. Your dermatologist knows skin. Your psychiatrist knows mental health. But who's connecting those dots between all of them and the food on your plate? Who's asking about your morning coffee, your evening wine, your vitamin supplements, your herbal teas? And that's where I come in. And that's why this podcast exists. When Food Meets Medicine is a podcast with one laser-focused mission: to explore food-drug interactions across every medical specialty. Every single episode will feature a conversation about how food affects medication in a specific field of medicine. We're going to talk to cardiologists about grapefruits and statins, leafy greens, and why timing your blood pressure medication with meals matters. We're going to talk to dermatologists about how dairy affects acne medications and why certain foods can trigger skin reactions. We're going to talk to psychiatrists about caffeine and anxiety medications, alcohol and antidepressants, and the supplements that interfere with mental health treatment. We're going to talk to transplant surgeons about the life or death importance of avoiding certain foods after organ transplantation. We're going to talk to endocrinologists about cinnamon supplements and diabetes medication. We're going to talk to nutritionists and dietitians about the supplements that interact with prescription drugs. But here's the most important part. Every episode will circle back to food-drug interactions, because that's our North Star, that's our expertise, and that's what makes this podcast different from every other health show out there. Because here's the truth. You can have the best doctors, you can have the best medications and the best intentions, but if you don't understand how food affects your treatment, you're flying blind. So this podcast is also building on something bigger. I wrote a book called Foods That Clash With Your Prescription. So this podcast is the audio companion to that mission, bringing you expert conversations, real patient stories, and actionable advice you can use today. So let me introduce myself properly. I'm Dr. Remi Olukoya. And I earned my Doctor of Pharmacy degree because I wanted to help people take their medications safely and effectively. I've worked in emergency rooms, ERs, community pharmacy. I've been a consultant, also independent consultant. I've counseled thousands of patients, and I've seen this pattern over and over again. Brilliant treatments failing because of a missing piece of information. But here's what really drives me. I've seen too many preventable problems. I've counseled patients who end up in the emergency room because they did not know that grapefruit juice could cause dangerous side effects with their medications. I've worked with elderly patients taking 10 different medications who had no idea that their calcium supplement was blocking 3 of their medications from working. So, early in my career, I assumed patients knew more than they did. I assumed someone else had already explained the basics. I assumed that if something was important, the doctor would have mentioned it. I was wrong. And I watched people suffer because of these assumptions. So I made it my mission to fill that gap, to be the person who asks the question nobody else is asking, to connect those dots between specialties, and to create a space where we can have honest, evidence-based conversation about food-drug interactions without fear, without judgment, and without shortcuts. This podcast is for anyone taking medication, whether it's 1 pill a day or 10. It's for caregivers managing medications for loved ones. It's for healthcare professionals who want to stay up to date on the latest research. And it's for anyone who's ever looked at a prescription bottle and thought, I wish someone would just explain how to take this safely. So there's a lot of health podcasts out there. There's a lot. Some focus on diet trends, some focus on fitness, some interview celebrities about their wellness routines, and that's fine. But it's not what we are doing here. When food meets medicine, it's different in 3 key ways. So the first one, we have one laser-focused mission: food-drug interactions. We're not going to talk about the latest superfood or the newest fitness trend. We're going to talk about the specific evidence-based interactions between food and medication. That's our lane, and we're staying in it. Second, we're bringing in specialists from every field of medicine. You're not just hearing from me. You're hearing from cardiologists. You're hearing from dermatologists, psychiatrists, transplant surgeons, nutritionists, dietitians, endocrinologists, experts who see food-drug interactions from different angles. And every single one of them will talk about food-drug interaction in their specialty. Third, we're telling real stories. This isn't a textbook. This isn't a lecture. Every episode will feature real patient experiences, the mistakes, the breakthroughs, the lesson learned, because stories stick with us in a way that statistics never will. And here, the other thing, I'm not going to talk down to you. I'm not going to use medical jargons and expect you to keep up. I'm going to explain things the way I would explain it to my own mother. Clearly, simply, and with respect for your intelligence. Because here's what I believe. You have the right to understand your own healthcare. You have the right to know how your food and your medicines interact. And you have the right to take control of your health in a way that works for you. So here's my vision for when food meets medicine. I want this to become the go-to resource for anyone trying to understand food-drug interactions. I want patients to listen and think, finally, someone is explaining this in a way I can understand. I want healthcare professionals to listen and think, I learned something new today that I can use with my patients. But more than that, I want to build a community, a place where people can ask questions. They can share their experiences and learn from each other. So this podcast is part of a bigger mission. I wrote Foods That Clash With Your Prescription, a book that breaks down the most dangerous and common food-drug interactions in plain language. I also built the MediMeal Safe app, an app where you check whether your food is safe with your medications in seconds. And I also created MediMeal Plan, a personalized meal planning service that builds your weekly meals around your specific prescriptions. So think of this podcast as the audio companion to all of that work. Every episode will give you insight, stories, and actionable advice that you can apply immediately. And here's what I believe. You have the power to change your health outcomes, not by replacing doctors or ignoring medical advice, but by understanding your treatment, asking the right questions, and making informed choices about what you eat and how you take your medications. That's what this podcast is about. And that's why I'm so excited to have you here. You can become part of this community. First, subscribe to the podcast. We'll be releasing new episodes regularly, and you don't want to miss them. You can find us on Apple Podcasts, Spotify, YouTube, and everywhere else podcasts are available. Second, visit our website at www.pharmaplansystems.com. We have free resources including guides on dangerous food-drug interactions, medication timing tips, and more. Everything is evidence-based, easy to understand, and designed to help you take control of your health. Third, send me your questions. If there's food-drug interactions you want us to cover, or a medication you're curious about, or a story you want to share, email me at hello@pharmaplansystems.com. I read every single message, and your questions will shape future episodes. And finally, share the podcast. If you know someone who's taking medication, and let's be honest, that's almost everyone, send them this episode. Share with your family, your friends, your co-workers, because the more people who understand food-drug interactions, the safer we all are. I also want to thank you. Thank you for being here. Thank you for caring about your health. And thank you for trusting me to guide you through this journey. Before we go, I want to leave you with one thought. Every day, millions of people take medications that could save their lives or improve their quality of life dramatically. But too many of these treatments fail, not because the medicine doesn't work, but because of something simple, something preventable, something nobody talked to them about. That ends here. That ends now. With this podcast, we're starting a new conversation. A conversation about food-drug interactions across every medical specialty. A conversation that could change everything. So, welcome to When Food Meets Medicine. I'm Dr. Remi Olukoya, and I'm so glad you're here. In our next episode, I'll be joined by a fellow pharmacist who's spent their career advocating for patients, fighting for better education, better communication, better outcomes. We're going to talk about the systemic gaps in healthcare and, of course, the food-drug interactions that patients need to know about. Until then, stay curious, stay informed, and remember, where food meets medicine, knowledge is your best protection.